Think you know the typical signs of diabetes? Think again. There are hidden foot symptoms that could be warning you about your blood sugar level, signs that many people overlook. Yet they can have serious consequences for your health. You might be surprised to learn that your feet can tell you a lot more about your blood sugar than you think, while we all know about the more obvious signs. Like frequent urination or increased thirst, foot symptoms are often the silent culprits that fly under the radar. But don't worry. Today we're going to dive into 5 lesser-known foot signs of diabetes that could be silently warning you about your blood sugar levels. These signs might seem small or unimportant, but if ignored, they could lead to much bigger problems down the road. So, stick around as we uncover these hidden symptoms and empower you with the knowledge to take control of your health before it's too late. Symptom number 5. Cold or numb feet. If you're experiencing cold or numb feet, it could be a sign that your diabetes is affecting your nerves. Diabetic neuropathy, a type of nerve damage caused by high blood sugar, often starts in the extremities, especially in the feet. This nerve damage can cause abnormal sensations, like a feeling of coldness or numbness, as the nerves in your feet become less able to send signals to your brain. In addition to nerve damage, poor circulation, another common complication of diabetes, can also contribute to cold feet. When blood sugar levels are not well managed, blood vessels can become damaged, which hinders blood flow to the extremities. This lack of proper circulation causes the feet to feel unusually cold or even numb, as the blood struggles to reach these areas. The problem with ignoring cold or numb feet is that it can lead to more serious complications. If you're unable to feel your feet properly, you might not notice cuts, blisters, or ulcers, increasing the risk of infection. In severe cases, poor circulation can lead to tissue damage and even amputations. If you experience cold or numb feet, it's crucial to monitor the symptoms closely. Ensure your blood sugar levels are well controlled and consider speaking with your doctor if you notice these sensations becoming more frequent or severe. Catching these signs early can help prevent further complications and keep your feet healthy for years to come. Symptom number 4. Skin dryness and cracking. High blood sugar levels can affect your skin in more ways than you might think, especially on your feet. One of the less talked about signs of diabetes is skin dryness and cracking. When blood sugar levels remain elevated, the body can lose moisture, leading to dehydrated skin. This is particularly noticeable on the feet, where the skin can become excessively dry, flaky, and even cracked. Dry, cracked skin creates an ideal entry point for bacteria, increasing the risk of infection. Small tears in the skin, often unnoticed due to reduced sensation from neuropathy, can easily become infected. These infections can spread quickly, and when left untreated, they can lead to serious complications, including ulcers and, in extreme cases, amputations. To prevent this, it's crucial to keep your feet moisturized. Use a good quality, diabetic-friendly foot cream or lotion to maintain hydration in your feet. Avoid applying lotion between the toes, as this can trap moisture and encourage fungal growth. Regularly check your feet for any cracks or blisters that could signal a deeper issue, and treat any signs of dryness immediately. If you notice that the dryness and cracking are becoming severe or leading to skin tears, don't wait. Consult a healthcare provider. Catching this sign early and taking action can help protect your feet and prevent further complications. Always remember, good foot care is essential for diabetics to maintain healthy, happy feet. Symptom number 3. Redness or swelling in the feet. Persistent redness or swelling in the feet is often more than just an inconvenience. It can be a sign of underlying inflammation. For people with diabetes, these symptoms can indicate poor blood circulation or nerve damage, both of which are common complications. When blood flow is compromised, especially in the lower extremities, it can lead to inflammation that causes your feet to appear red and swollen. This redness and swelling can be linked to conditions like diabetic neuropathy, where nerve damage impairs sensation in the feet, or peripheral artery disease, which affects the blood vessels and restricts blood flow to the extremities. When these conditions develop, they can cause the feet to swell and become painful, and the skin may become inflamed as well. The danger of this symptom is that it often goes unnoticed by those who have nerve damage because the loss of sensation dulls the pain and discomfort typically associated with swelling. That's why it's so important to regularly check your feet for signs of redness or swelling, especially if you've been living with high blood sugar for an extended period. If you notice persistent redness or swelling, don't ignore it. These could be early warning signs of more serious complications that require immediate attention, left untreated. These conditions can lead to infections, ulcers, or other complications that might affect your mobility and overall health. Always consult with your healthcare provider if you experience this symptom, as timely intervention can prevent long-term damage. Symptom number 2. Persistent foot odor. If you've noticed an unpleasant, persistent odor coming from your feet, it's more than just a hygiene issue. It could be a sign of something deeper, especially if you have diabetes. High blood sugar creates an environment that is ideal for bacteria and fungi to thrive. When blood sugar levels remain elevated, it can weaken the immune system, making it harder for the body to fight off these microorganisms, which are often the culprits behind foot odor. This odor might be linked to fungal infections, like athlete's foot or fungal nail infections, both of which are common in individuals with diabetes. These conditions thrive in warm, moist environments, making your feet an ideal breeding ground, particularly if blood flow to the area is impaired due to diabetic complications like neuropathy or peripheral artery disease. Persistent foot odor may not just be about sweat. It's often an indicator that an infection is developing or has already taken root. While mild foot odor can be common, if the smell is constant, strong, or worsens over time, it's important not to dismiss it. Fungal infections, if left untreated, can cause significant discomfort, lead to skin breakdown, or even result in more severe complications. Maintaining proper foot hygiene is crucial. Make sure to wash and dry your feet thoroughly every day, paying attention to the spaces between your toes. Moisturize your feet to prevent cracking, but avoid excess moisture. If the odor persists, worsens, or is accompanied by other symptoms like redness, swelling, or pain, it's essential to consult your healthcare provider for appropriate treatment. Catching infections early can help prevent further complications and protect your overall foot health. Symptom number 1. Foot cramps or muscle weakness. If you're experiencing frequent foot cramps or muscle weakness, it might be more than just fatigue. This could be a sign of diabetes-related nerve damage or poor circulation. High blood sugar levels can impair the nerves that control muscle function, leading to discomfort like cramps and difficulty moving your feet. This is often a result of diabetic neuropathy, a condition where the nerves are damaged due to prolonged high blood sugar. When the nerves in your feet are affected, it can disrupt the normal signals sent from your brain to your muscles, causing cramping, weakness, or an inability to control foot movements properly. This makes walking more difficult and can increase the risk of falls or injuries. Additionally, high blood sugar can affect circulation, reducing blood flow to the feet and making it harder for muscles to get the oxygen and nutrients they need to function correctly. Poor circulation can exacerbate muscle weakness, causing the muscles to feel stiff, tight, or fatigued even after rest. These symptoms are often overlooked, but can be early indicators of neuropathy or circulation issues, which, if left untreated, can lead to more severe complications like ulcers, infections, or even amputations in extreme cases. If you're noticing cramps or weakness, it's important to address it as soon as possible. Regular foot checks and maintaining stable blood sugar levels can help manage symptoms and prevent further damage. Be sure to consult with your healthcare provider to discuss your symptoms and consider adjustments to your diabetes management plan. Early intervention can help protect your mobility and quality of life. Conclusion: Let's quickly recap the 5 lesser-known foot signs of diabetes: cold or numb feet, skin dryness and cracking, redness or swelling, persistent foot odor, and foot cramps or muscle weakness. Each of these symptoms could be an early warning sign that your blood sugar is out of balance and that diabetes may be affecting your feet in ways you might not expect. If you notice any of these signs, it's crucial to take them seriously and consult a healthcare provider. Early detection and management can help prevent more severe complications. So don't ignore what your body is trying to tell you. If you found this information helpful, make sure to like this video, subscribe to the channel, and tap the bell for more essential tips on managing diabetes and improving your overall health.